see that? Yes.
Can you say like the S value is too high to the size of it comes out?
I would say S value is too high because it's underexposed, yes. But we can't talk about S value because we don't see it here. But you can say that the exposure factors are not adequate because of how white the spine looks, because of the fact that we can't really tell the liver shadow or the kidneys, things like that.
Oh man, I can't just say it's too much.
All right, let's do this one. Way too high.
This is a upright.
Looks like they're doing an upright abdomen.
S value is good.
The marker is in the
S value is 400, so it's with the range. Markers in the anatomy, so that's not appropriate. What else?
So with the right side be elongated or something?
It's clipped on the right side, which means the patient was centered too much to the right, right? Take a look at the spinous process. Are they all going straight down?
No.
So it looks like the patient has some sort of rotation going on in the lower half of their body.
So would the right hip be too? I don't know.
The right iliac crest looks foreshortened compared to the left, right?
So on the other one it was elongated, right? Okay.
Can you, I have a question.
Yes.
Can you talk about the spine being curved? Because that could be scoliosis, right?
Scoliosis, it will have more of like an S curve. This one doesn't
Like a
really look like a scoliosis to me. Just
That
looks
one
like the
looks like
patient
it's
is
not
tilted and
straight.
rotated.
Yeah.
Yes.
I think that is perfect.
Could that also happen from the body not being perfectly aligned? Like people can move their upper half, but forget to bring their
Exactly. So if you take a look at their hips, it looks like they're rotated, right? And also looks like they're slightly tilted too.
And you're checking the tilt by the spinous processes, right?
By the level of their iliac crest.
The
Like
level of
this
it.
right one looks like it's slightly.
A little bit lower?
All right, how about this one?
This looks more
Digital marker, okay.
It's still too light.
It's too white?
Right. No, I think the contrast is good.
Okay, so for those that are saying the contrast is good, support your claim.
So you can see
different densities.
Okay, you can see air in the intestines, right?
and the bones are wide and nice.
Okay, you can see the transverse processes of the lumbar vertebrae, correct?
Yes, ma'am.
Can you see the psoas muscle?
Psoas muscles, you can faintly see it on this one actually.
Which one is
Very
it?
likely.
Yeah, I was sure.
Right there. What about this one?
It's the baby.
Baby.
What's the S value for a pediatric abdomen?
56.1.
2 to 7. Okay, good job. She came in late, but she knew it.
2 to 7.
I think she's
200 to 7.
Oh,
So this one is 210, which means it's in the range. But what can we say about this? Collimations, not inappropriate.
Not
We have the
centered.
head in the image. Patient's pelvis and legs are all over the place. There's rotation in the chest. How can we tell rotation in
One
the
side
chest?
is bigger, the hips are bigger than the other side.
So don't use the word bigger,
Longer.
use the word elongated.
Elongated.
Alright. So y'all are getting the idea, right?
I think we got it.
Okay, let's test your knowledge, Miss Charo.
No.
A, what is A?
What is a
B.
She knows.
Anyone?
It's the soft tissue of the
Lifeline?
abdomen.
Somebody help me.
Jay?
I'm sleeping.
Are you asking about the intercostal space?
Nope.
No.
Okay.
But that's what that's
what it looks like.
part of it right there.
I wonder if I was meeting an organ.
Shemaiah's hands in the air.
Left kidney.
Kidney.
I said that.
So do you guys see this gray outline right here?
Hardly, man.
Not really.
Hardly.
I mean, this one I come in.
Is she in the front? Yeah.
Imagine a
So
kidney.
on the test, I would say organ, so that way you'll know what I'm talking about.
Thank
So,
you.
can you outline it again one more time, please?
That's way
Yes.
too big to be a kidney.
So you can see.
I'm looking here. I'm looking
Okay.
here.
So this
Oh, that's where it
gray
begins?
shadow right there.
Okay. Okay.
Yeah, I could barely see.
So then the other one would be here.
That's correct,
Yeah.
right
Okay.
there. All right, what's B?
Is it
The fourth pedicle.
Is it the left?
I think I heard somebody say it.
Shemaiah, go ahead.
To me, it's a chances process.
Oh, I thought you
The
said.
fourth
L4.
left pedicle.
What she said?
I thought you said B.
Oh, transfer.
Huh?
Well, it should
It's not
be,
pointing at the transfer.
yeah. So wouldn't it be a little bit more out the wing?
Hold
No?
on 1 second. Transfers process. Remind me.
Yeah, it's the little wing.
It's a little wing that
Yeah,
looks like that.
they
Them
stick
little
out.
circles are the pedicles.
Right here,
next
right?
to it.
Yeah.
Yeah.
But
Well,
it's,
you pointing at
Yeah,
the
so that is the transfers process.
Okay, it looks like the pedicles.
I thought it was
Like
pointing
it's
at the
pointing-
Yeah, I
hole.
thought you pointed at the hole.
This thing right
Oh,
here.
You have to bring that line out.
The whole, the
You
whole thing.
gotta get some better images than
Wait,
that.
wait. Miss,
Well, don't put pedicle on the test then, and then we'll know
This
that's
class
the
is a hard
transfer.
crowd down
So
here.
this
We won't have any choices.
Miss
I'll
Bonilla.
give you choices. I'll give you choices. Yes.
So then, could you? Would we be able to see the superimposed pedicle here, or where would we be able to see it?
The pedicles are over here on the inside of the spine.
So that would be the-
I should have put the arrow up over here.
Yeah,
On
on the
the-
wing, like,
Yeah.
yeah. It's okay.
My bad.
It's okay. It's okay. You're still teaching the
So
semester.
I must
C.
So I so
Go ahead.
The
Left.
left.
So I muscle. D.
D,
It's the
the
real-
you only came with
12th
just
rib.
right.
Right 12th rib.
Right kidney.
So E is pointing to an organ.
Right kidney.
Liver.
Liver. Liver's on the right
So
side.
what happens to the
Listen,
kidney?
it's the shadow of the liver, barely seen, but we know that's what it
Now
is.
what happens to the kidney?
What?
What happens to the right kidney?
The kidney is
Uh-uh.
not
It's
up
down at the
here.
bottom.
The kidney's over here.
And then when we show the left kidney quite up there.
Because the left kidney sits higher than the right kidney.
That's right.
Don't come from each
There's a
other.
reason.
All right, last one. F. It's an
Bladder.
organ.
Gallbladder.
Bladder.
Gallbladder.
Whoa!
I hope your gallbladder's not here. Yes, that is your
It better not be
bladder.
right
It
there.
better not be
They're
falling
aliens.
out, your
I remember that from the second review.
Yeah.
All right.
Y'all having too much fun back there.
Not down there. The alien is
All right,
there.
focus. Let's talk about left lateral decubitus abdomen. Where do we center for that? Collimation and evaluation criteria stays the same. When you suspect fluid, side down. When you suspect air, side up. Right. Rotation, everything is still the same, just as we do for an AP abdomen. Okay.
What do you mean by this side down and fluid is suspected and side up and fluid?
Shaheen, I know I told you this at least 10 times.
Sorry.
And down, you really
Okay,
doing the
I
same
know that
thing.
if the fluid sets down, so the side.
So,
I don't know
okay.
what you're trying to tell
So,
you, side
remember
down.
you said fluid falls and air rises.
Yeah, but what are you trying to
So,
say here?
so when
Fluid
you-
falls.
No, she
Oh,
doesn't
that's
know like the side down.
So if you
I didn't-
suspect fluid on the left side or near the abdomen, you would
Oh,
put
that
the
you
left
on the
side
left,
down.
yes.
Down.
Yes, ma'am.
If you suspect
Air,
air,
you go this out.
you
side
want
up.
to put the
The
side
left side
up.
up.
Yes, ma'am. Thanks, ma'am.
We also said we only do left lateral.
Yeah, left lateral is very much preferred for
It's the
abdomens,
same.
for pneumoperitoneum, because air rises away from the gastric area, right? Let's evaluate this image.
Okay, so it is a decubitus because there's,
It's a
The sheet.
decubitus, left decubitus position, because the right side's marked. We always mark the side up.
and also you
Okay.
can see the sheet, man.
Shape of what?
Sheet, man.
Oh, the sheet, okay. Well,
Artifact.
there's an artifact.
The left ilium is foreshortened.
Left ilium is foreshortened.
Rotation
Yes.
is occurring.
Okay.
They do not.
What about centering?
It's kind of
And we're
Yeah,
centering
also
2 inches above the crest.
I think it looks pretty good.
Looks pretty good.
It's gonna be good today.
I like it.
Seeing.
I like it.
It's good.
What about the spinous processes?
They still look
It's going to be wonky because earlier we said that the patient's rotated.
Oh, yeah.
So it's not going to be in the midline, right? What about the exposure factors?
Exposure factor is good, darkening, contrast is good.
It's good? Okay, explain why.
Because you can see the air, in
You
the-
can see air. You
The
can
fat.
see.
and then you can see the bone nice and white,
Good job. Where do you
Peritoneal
see that? Do you see this?
the ribs.
Remember that peritoneal fat layer that I told y'all about? Can't really see, well actually you can see psoas muscles. See this
Yes.
shadow right here?
Yes, ma'am.
Alright, good.
But why can you only see it on one side every time?
No, you see it on both sides usually, but on this one I can only see the one on the right. And this one?
Hello.
Baby again.
It's a baby, okay. Talk about positioning.
Ooh.
Oh, you can see the legs. Virgin. So it is decubed.
Okay, what about the air?
It's up.
If it's
It's stuck.
Yes, so
Could say
it's the
that
right
fast.
side's up, so
Left decubitus.
left lateral decubitus, we can see that the air rises away from the left side. What about rotation? We see that the right ribs are elongated, correct?
Mm-hmm.
Collimation, could have collimated it down a little bit. And artifacts, could have removed those wires out of the picture.
Ma'am, they call it. I have some-
Exposure, I feel like this is probably slightly underexposed because everything looks super gray in the abdomen. You can't really tell much of what's going on. So,
Ma'am, I have a question.
yes,
The space above the leg of the baby.
where, right
the
here?
right, no, on the right. On the right.
That's the
corner.
arm.
That's the arm. Oh, I see. And the space above the arm of the baby
Mhm.
and the space below is equal, ma'am. So I don't know why you said collimation is not correct.
It's not equal.
Not here, ma'am. If you see from the arm and then because you
So it's a lot more here than compared to here.
I see. So it has to be in the center also, the vertebral column.
Yes. So that was it for the abdomen. Any questions? Okay. And we already went over PHS a couple weeks ago, so I'm gonna skip through
Every
this
day.
part.
Oh,
Let's
could you
do some
put the-
anatomy.
That's every day.
Goes in the passport?
Yes. Let's do the anatomy. What's A, Shaheen?
What's
Letter A.
I don't know if it's the spinous process because it's below the spinous process. But
So it's pointing to this dark area right here. What do you think that is?
Take a deep breath in.
I'm not sure. Now. The spinous process and the pedicle
It's a chest X-ray.
It's a chest X-ray.
Air fills the trachea.
So then
Oh,
what?
look at
Mr. Herman and
Come on
Mr.
in.
Herman.
We're gonna find information about the X-ray.
What?
We're trying to apply to X-ray school.
Again?
The film.
Again?
They lying.
Right.
More classes.
All right.
Ask him.
Nick, what's B?
E?
Yeah.
That's the peripheral trachea.
No.
Whoa.
That's
Oh, I thought. Okay.
He passed pass the registry, forgot
Oh,
everything.
that's it.
Revoke his license.
Right? Apex. Apex is the right.
Okay, right, Apex. Good job. C. J.
What's up?
You're too busy
Says-
texting over there.
Oh.
There's a lock on my phone. C is the aortic notch.
Okay. Aortic arch, I like that. D.
That's what I would say.
I think this answer is pretty basic. It's just the lung. That is the lung, is it not?
Yeah. It's the right.
But that could be a lung space. It could be an intercostal space. It could be.
What's E?
The heart shadow.
Heart shadow. Heart shadow. F?
Base.
Base or diaphragm?
Base.
No, I think it's pointing to the diaphragm.
Diaphragm.
And G.
Cosmophrenic angle.
Right
The right
cosmophrenic angle.
How can you differentiate
Alright.
between the diaphragm and the base, man?
If you said base, I wouldn't take off points.
Well, I'm gonna put base slash
But if you look at the image closely, it's pointing to the space right under the dark area.
If it would have pointed on the other side, we probably.
So the one in the dark would be the base.
A little too right for my taste. For my taste.
Ooh, now I know how Mr. Donahue feels.
Uh-oh.
Break time.
Alright, Miss Emily, what's B?
Uh-oh.
So it's pointing to the dark area of the chest X-ray. So this is not part of the lung, actually. Think about the passive Oh,
What?
didn't I say that?
I got it right. I did say that.
C is aeroesophagus.
And then D is trachea.
Yeah.
D
Well,
is
I
trachea.
answered B, C, and D.
So if you take a look at D, it's right in front of C, right? And we know that the trachea is in front of the esophagus.
Because I said apex, she said no, it's not a part of the lung. I said okay, trachea.
My
She said
bad.
no. And then she said esophagus. I said, yes.
She had lunch.
What's
And
B?
you told them to defend their answers.
F.
The
Yeah,
highlight.
yeah.
Highlight region.
G.
The post.
You can do it.
Posterior ribs. H.
Heart shadow.
Heart shadow.
Yep. J.
Base.
D.
Diaphragm. And cosmophrenic. Who wants to evaluate this for me? They already got a job. They don't have to write.
I volunteer John's as tribute.
I'll do it.
You want to do it?
Sure.
Okay, go ahead.
The sun rings off
Okay, tell me why.
because they have the abdomen in it too
They have the abdomen where?
on the X-ray.
MSP or
It's too much on the right side.
If you look at the center, it's like T8, T9.
Too much on the left, yeah, but it's open.
Can't really see the spine over here, but you can talk about how there's all of this space compared to little space over here.
That'll be cognition.
Center.
No, but the space. Oh, I thought. Never mind.
Isn't it
Yeah.
though?
So
Yeah.
if you're talking about centering, you can talk about the extra space here compared to this, and also collimation. What else?
Digital marker.
Digital marker.
The S value is,
S value is 167,
which is good.
which is good.
And no, the
Portable
clavicle.
chest is 100 to 400. Why do you think, if the S value is good, why do you think this is all whitish?
That's the pathology.
What kind of pathology?
There is solidification.
Yes, it's fluid. Fluid appears very white, right? What else? Do we have any rotation?
Yes, the clavicles look long. The left side looks long.
So the right side, I could see some space between the clavicle and the spine, but on the left side, it's very close. So there's some rotation going on. Okay? what about this image?
I don't know, but it's real scary.
Charo, why don't you do the honors?
Oh, it's scary.
The S value is 630.
That's too high, right?
Too high, which means what?
It's underexposed.
Underexposed, okay.
It looks like they rotate because of those ribs.
Because of the what?
Ribs.
Posterior ribs are not superimposed. Okay.
They got a lot of trouble over here. Answer y'all. I'm not offended.
Is there our artifact?
Artifacts.
Yes.
What are those?
Is that nipple piercing?
No. EKG leads.
Oh.
Look at the sternum. Oh yeah, we can clearly see the sternum.
Yeah.
What about centering and collimation?
Centering is off.
Off, and tell me why you think that.
Looks like it's too far down. Too much at the top.
Centering looks like it's right there,
Centering
which
looks pretty
looks
good.
really
Close to
lower
T7.
than T7.
It looks like it's too far down. And
what about the MCP?
It's not centered properly. The CP is too far back.
Looks like they center too anterior, right?
Yep.
Okay. All right, and last one.
Uh-oh. Another one. Who found these images?
Monty. I know you know the answers.
Well, there's no marker.
There's no marker,
There's
okay.
rotation because of the posterior ribs.
Okay. What about the exposure factors? Underexposed. All you can see is very white or very black. You can't really see gray shades, right? Looks like there's some sort of motion going on here. And what about this image?
Very underexposed.
Very underexposed.
Center too low.
Center too low. You can see their C-spine. What about positioning? Their arms are in the picture. What about rotation? Looks superimposed, so
Yep.
I don't see any rotation.
What about the lungs?
What about the what?
Lungs on that one? Or is it kind of faded out at the bottom? That's why we got it.
Yeah, these are the arms.
Please can you explain, you said centered low, you can see the C-spine.
The centering looks like it's right there.
So that is low would be
It's
the-
lower than T7.
So you should be able to see the C-spine.
See right here?
So if it's lower, then you should not be seeing the C-spine. Centering is low.
You're correct. So what can we say about the centering being too low?
So if it's too low, you see the.
Is it too low or is it too high?
Probably too high. So if you send it too high, when you see the,
That's when you guys see the C-spine.
It looks too low to me.
yeah, that's what I'm saying. If it's too high, you'll see the C-spine. So it's too high.
Or is it?
Oh, they just got a long neck.
Daddy long. Wonder if he has the extra C-spine.
So you can say too high because we see C7 over here, and then Monty said that the cluster-fronting angle is over here.
Getting cut.
Okay, I'll take that.
So is it getting cut back? Then cost-
No, it's very close to the bottom of the image. Okay. What about this one?
Off-centered.
The L spine is rotated to the left.
Okay.
So the patient is not standing straight.
Off-centered. Okay, tell me why.
You see more space on the left than the right. So are they shifted to the right?
They're definitely tilted to the right because you can see that their lungs are over to the right, right?
Bottom half is going to the left.
And then if you take a look at the lumbar vertebrae here, it's tilting to the left. So there's tilting to the right on the torso and on the bottom tilting to the left.
The markers in
It's not really
Yeah.
in the anatomy.
you can see too almost the base of the skull.
Yeah.
It's too much.
Or it looks like it's their chin.
That's just.
So collimation's very open. Let's see here, centering.
So when you say collimation open, what are you looking at now?
5, 6,
On the
7.
top?
Centering
The
is pretty close to
sides.
T7. Collimation, take a look at the chin here.
Because
Look
it's
at all
in-
the space. That's
Or
not how we.
Sides and the top man,
Yes.
both of them.
Almost clipping the right.
Right foot.
Clipping the right way.
Cause we got everything we need for a chest. We ain't gonna over it.
The S value for this is
I'm
400.
going too deep.
Just
Is that okay?
It's on point.
It's on point? Okay.
200 to 600, yes.
What about the clavicles?
now because the space on the left side, the space with rotation towards the right. Because
Anyone?
this
Anyone?
There's a slight opening on the left.
on the
So clavicles are not equally distant from each other. You can see there's space on the left side, which shows you that there's rotation, right? Okay.
rotation on the left side or a rotation on the right side when you see left.
What side's elongated?
The right side looks elongated?
Yes, it does
No.
look elongated.
The clavicle looks very short.
I think the left side.
The left side looks elongated to me.
Yeah.
What do y'all think, Anthony?
Oh.
I think the right.
If you look at the spinous
class.
processes, you're seeing that they're pointing slightly to the right, so that's going to show you which way the patient is turning. So that'll kind of give you an indication of it.
So is the right or left side elongated?
So then it
The
would be
right or left side elongated?
Yeah, which side do you think looks more elongated?
This
It's very slight, but I'm thinking it's left side's elongated.
See, and I
If the
think
spinous process is going to the right, then that means the left should be long.
Yeah, that seems to be the case.
And
The left
also-
is slightly more.
And also, if you look at the clavicle, it's more open on the left side.
So this, if it is open, and there's a space with the clavicle on the left side, then the turning is towards the left, ma'am, or towards the right.
Towards the right.
Towards the
Because if
right,
you're
then
turning it towards the left, it'll be closed.
it will be open on the right. Then. So opposite.
It's one
Both
o'clock.
ways at all.
It is?
SC joints is whichever is touching the right arm. So if this is up, then you're looking at the right. So if you're saying that you're going towards right,
So the SC joint, don't compare the SC joint with the chest. We're gonna get confused.
Did you talk about the markers in the soft tissue?
The marker's in the soft tissue, but it's not, what's the word, obstructing any anatomy that we want to look at. That is it for today.
See? I was trying to say one line.
There's many of them.
Oh, yes,
Are we having a test on Tuesday?
Thursday.
Next Thursday.
Test is gonna be next Thursday.
Which is chest and abdominal, right?
Chest and abdomen.
Are you gonna like go over how the test is gonna be like? Right.
Basically, just like how we did it, you're gonna have about 7 or 8 images, and you'll evaluate them. And it's
Online or paper?
paper.
Paper? What if you can't read? I write in cursive. You can read it.
That's fine. I'll try to figure it out. Yes, Samantha.
And it is gonna have like the picture, and it's gonna have the X-ray they were attempting to do, because I know we've seen here that they were kind of pretty bad, but it's gonna have like the X-ray.
I'm not gonna give you any crazy looking images. If you're unsure, just ask me.
Okay, and then it is gonna have anatomy labeling on this test.
Yes.
Okay, and you said no more than about 7 to 8 images.
7 to 8 images. Yes.
Okay. So.
What do you mean by Miss Bonilla, what do you mean by not labeling? What will you include and not include?
You'll have to label the anatomy.
Just anything about the
Yes.
Don't worry, Miss Amy.
Oh, I know.
We got it. We don't know there's a deadline. Don't worry, just over some of this early. Literally.